Welcome back,
Professor.
everybody. I hope you had a great week. We are back to our regular program to get ourselves into the profession of sterile processing. Okay. I think I'm very happy that we are back. But as I now have 9 people, I think we're supposed to be 27. So we just gonna give the others maybe a couple of minutes to see if they show up. Yeah, but as of now, we are going into chapter 18 for today. Alrighty. Yeah. Do you guys see my slide now? We're going into chapter 18 now. We'll be doing quality assurance in central service operations today. So that is what we have all prepared for, I guess so. But then before this, does anybody has any question about anything at all about this program as we wait for the others to come in? Any questions at all about this program? Anything about this program? About the clinicals, about the course itself? Anything?
I have a question. So when we finish the classes and like do we do clinicals then the state test?
Oh, it's up to you because I using me myself as an example, I didn't do the clinicals before the state test. I took the state test before the clinicals.
Okay.
So there's no set format that you should do it. Some actually do it concurrently while they're doing the class, they're doing the clinicals. It makes it easier for you though, because you see a lot of the things that some of the things that you'll be asked about, you would have seen them already. All right. But me as an individual, I did the state test before going for the clinicals.
Okay.
Yeah. Any other questions? Any concerns? Any concerns? I know other schools are doing this program, but you can't even get a clinicals. But still, the students are able to do it, and then they go and do the state test. I can't actually talk about their past status and maybe how many people are able to go through that easily. But I believe that to be wholly prepared for it, if you do the clinicals before you even finish the classes, you should be well armed to do it and get it out right away. Yeah. But here with how we're doing it here, as I always say, by my own standards and how I went through it, what we're doing now, this one is more of a holistic approach to the program with different tutors coming in, giving you all the experience that they have, giving you all the things that they've seen, and people who are on the job. We tell you things that the book doesn't tell you. We tell you things that we've seen that the book doesn't tell you about. Those are all good, and we give you points at areas that look, this is usually on the test. This is usually this way. It's good. You have a foot ahead. So you can still do it even without the clinicals, but then the clinicals is a requirement before you get really fully certified to work. Okay. So it's 3:04 now. I think we should just begin something. We have at least 16 people in here now. So let's do something. We're talking about quality assurance in central service operations. Can anyone just give us an intro to this quality assurance? Why quality assurance in central service operations? Why? Why do we need quality assurance? Why should we be like, oh, we need quality here, but then the quality is not just quality, it must be assured that there is quality. There must be something to prove that this is our status. You know, want to say anything about it?
For patient care?
For patient care, yeah, we want a perfect score. Patient care, you can't risk it, all right? We can't risk it in any way. So if it's about patient care, then there should be quality. All right, there should be quality. Not just go there because you're going, but it's about patient care. The patients are humans. There are other people's loved ones, and it could be your loved one too. God forbid, but it's about other people's loved ones. There was a time I came home from work. My daughter, my little girl, she's 4 now. She was sleeping though, but the way she was sleeping, I didn't like it. So when mom woke up, she said, "Oh, Nana got injured at the park." So wow, how did she get injured? So she fell from one of the swings and stuff. And I know she's not afraid of heights, so she will climb anything, anywhere. So I said, "No, my God, this girl climbs high things. So I need to take good care of this right away." So the next morning, even though you know how kids are with pain, sometimes even it's a big fracture, but they will be able to contain it. They won't even be crying too much. So this girl woke up. She was still, when you raise the hand, you see that she wasn't raising it properly. So I said, no, I have to take it straight to. When I went to the children's hospital. Yeah, and as soon as they did the X-ray, but the thing was, they saw me. I told them, look, I work with sterile processing. I showed them my badge, and they said, okay, good. So they were like expediting everything. They took her X-rays, and there was a fracture. It wasn't big, but it needed surgery. So imagine this: I was at work a couple of hours ago. I didn't even know I was going to take my kid to the OR, and it happened. Okay, this is a real life story. I couldn't even tell her mom because she would have maybe passed out before I got back home. So right there, they said, okay, we're gonna do this. We're gonna do this. We're gonna call this surgeon. Well, then they came and gave me the confidence that look, you are in the job. You know how this thing is. Everything is good here. We're gonna call the right person to come in so that we take care of it. But she has to go for this. Sign these documents. I did everything, and then the next minute she was in the OR. I didn't even call mom. So I waited. When she came out, then I called mom that look, this is the situation, but she's out of surgery and she's recovering now. So look at this life situation. It could be anyone. So you can't say that, oh, it's not going to happen to me. And this is why quality must be assured in the SPD. All right? You don't know who is going to be there. And the point is, anyone being there is a human being. What do you expect for yourself? You have to expect for that same person, that other person there. So any questions? No questions, right? So this is like a realistic situation. So look at our introduction to quality assurance. This first slide says healthcare consumers' expectations. Okay, what I want you to do in this program now is that put yourself as the consumer. Put yourself as a consumer because you are a human being. You could be a patient anytime, God forbid, but put yourself in that situation. That's how we can look at what do we really expect from SPD. Okay, so put yourself like that as the consumer. Demand for high quality products and services. That is what you will want yourself to get. You don't want anybody touching with a filthy instrument, a non-sterile instrument. You don't want that, okay? So all consumers that we're talking of, that we serve, always demand for high quality products and services. They expect the best for themselves and loved ones. So what is our role here then? We have to establish and maintain these quality levels. Serve internal customers, which are going to be the physicians, the nurses, give them what they need from us to go and offer the best care they can give to the patients. It is our job to do that. And that's why we are saying that you are not only going as a technician, but you are going as a professional. Serve these internal customers like physicians and nurses what they deserve to go and do the right patient care. We all get that? So that is something that is very realistic. I keep saying that this topic that we're doing now is realistic, that we should put ourselves in that position all the time. Good. I see that from, who is that? Shania, right? That's a good one. So the impact of quality on health and safety, it affects patient outcomes because of what I just said earlier. if we are not using quality, like quality instruments out there, it means that we are not going to give the best out there to the patients. So there's going to be an impact. So what we do, if we do poor work, the impact is going to be poor out there. And we can't compromise that. As we say, we just don't compromise anything because it's about life, it's about loved ones. We don't want anyone going through that. So what impact do we expect? Patient care at its best. That is the impact we expect. So we know that what we're doing affects patients' outcomes and facility success. We don't want our facility to go now in the books as, oh, this company is no good. They have dirty instruments. Their thing is poor. We can't afford that. We can't afford that. So we have to ensure that the impact of quality on the health and safety of everybody is in our hands, and we're going to prove it. Okay? Give me a minute. Let me refer to this quick. Yeah, sorry for that. So that is the point. This is going to be a realistic chapter, okay? And then we're talking of the significant consequences for patients and personnel. You can know it. It's far-reaching. If something should happen to a patient, a bad thing should happen to a patient, it goes far. There was a time I went to my hospital. I entered in the afternoon. There were ambulances outside, fire trucks, police. I said, what happened? I went in. Somebody was on the floor. Okay. This had nothing to do with SPD, but it was with the hospital. Okay. Look at this. The janitors, the housekeeping people had done something wrong and somebody slipped. Thank God it was one of our workers. It wasn't even a customer from outside. Okay. So it was a bit like we could contain it in a way. But the point is, it must not happen. It must not happen. Okay. If it happens, it brings about significant consequences for these patients and the personnel. So it must not happen. And that's why I keep saying no compromise at the SPD. All right. Expanding role of the central service technicians. Processing devices for various healthcare facilities. Right now, I went to one of the hospitals. There are like more than 80 clinics, 80 clinics, bringing instruments to them, to that facility. So look at it that way. 80 different clinics bringing instruments to that facility. Different kinds of instruments. Some instruments will come, some have to be steamed, some have to be sterile, which I mean the low temperature. And they come and you have to take care of all that. And it's expanding because we keep bringing new instruments. Modernization keeps going. High tech keeps coming in. Robots keep coming in. So it's like it's an expanding role, and you have to accept that. Processing devices for various healthcare facilities is something that you're going to be doing. Quality monitoring and training. That is something that we do to monitor. Can anybody explain monitoring to me? Like, why do we monitor? What is monitoring? Just monitor. If we tell you to monitor something, what do we mean?
To observe.
To observe it. Good one. Sarak, that's a good one. To observe it, monitor it, look at it. How is it going? It's not necessary to say that, oh, I'm looking at it going up or going down, but look at it. How is it going? So that you can tell us, is it going the right way or is it going the wrong way? So you have to observe, and that is one of the things you are going to be doing. You're not just working, you have to be observing stuff. Observe the quality of work. In your own way, you can see that, oh, are we doing good or are we doing bad? If our systems keep failing, we are not doing good. If our instruments keep coming back dirty, we are not doing good. All right? And that means we have failed in quality. So that's why I keep saying this topic is practical. All right? It's very practical. It's not difficult, but it's practical. So everybody can relate to it. All right? So healthcare consumer demands that I spoke about already. What you want for yourself, that's what any healthcare consumer wants. Why will you go to the hospital in the first place? Can anybody tell me why you go to a hospital?
Quality service.
Good one. Quality service. And remember, before you are going there, there's a problem with you before you're going, right or wrong?
Right.
Right. Because if not, you'd rather go to work or go and chill somewhere. But then Sometimes you have no choice but to go to the hospital. Has anybody experienced anything like that before? Has anyone had an experience whereby he had no choice, he or she had no choice but to go to the hospital?
Yeah.
Yeah, how was it? Maybe you were in serious pain, right? You were so uncomfortable, in great discomfort. I said, oh God, this I need to see a doctor. I need to go right away. So in that situation, in that mood, what were you expecting? You were expecting that as soon as you get there, this pain should disappear as soon as they touch you. Right or wrong?
Right.
Yeah, as soon as you get there, even just by approaching the hospital, you know that, okay, that's your first point of saving. You saved yourself 1 point. Then as soon as they take your card, take your vitals, you say, okay, I'm on my way to recovery now. These people are going to help me. At that point, look at what you were demanding within yourself. That is what every healthcare consumer demands. They want rapid service, and the service should be of quality. It should be able to solve their problem for them. It should be able to cut the pain. It should be able to take the pain away right away. Okay? So healthcare consumer expectations, no book should tell you. No book should tell you. You should be able to tell yourself. Because you have ever gotten sick and you knew how it was and what you were expecting at that time to get out of it. That is all healthcare consumers demands. So what is your role here? Because you are expecting the best as a consumer or the customer, you were expecting the best care for yourself or maybe your kid that you send there. So now that you are coming in as the provider of that service, what is going to be your role? You need to establish appropriate quality levels. And it starts with you. When you are in the decon and you are washing stuff, you are cleaning stuff, you make sure you're doing what you've been told to do. Don't cut corners. Do what you've been told to do because it has been tested over and over that this is the right way to do it. And that's why we have all those policies and guidelines and regulations. So it starts with you. Establishing appropriate quality levels starts with you. Consistently maintaining these quality levels is what you should do. If it goes good today, tomorrow it should go good. It should not be today, but tomorrow, then it's no good. No. Our level of quality should be consistent. Any questions? Any questions? No questions? All right. So your role is going to keep coming up. But I've told you, this is a realistic topic. Your role will keep coming up. Look at your roles that are lined up here. Can anyone read them out for me? Just one student, each one could read one bullet. Someone should take the first one. Internal customers served by the CS technicians. What are they?
Physicians, nurses, and other professionals in the facility.
Yeah. So you see, these people that you're seeing, that nobody's going to tell you when you go there, they are walking around. You don't need to know who is the doctor or who is the nurse. Forget about their positions, but they are working there and they are going into the OR in and out. But then you are going to be serving them. At times they'll come and ask you questions. Last night, I was at work. This guy came, one of our techs. He came, Charlie, I need this thing. I've set up, but then I need the Codman retractor. I need the light handle, and I need this. So I said, okay, let me see. Let's check the inventory here. We checked, it wasn't there. Some rooms had taken it already. And then every room is equipped with certain specifics that certain instruments cannot be used in certain rooms. All right. So it was between me and him to find a way to make sure that those rooms that don't use the things that we need to go check if they have been put there. If they've been put there, we rather take them, switch them, give them the one day they need for the appropriate rooms to get what they also need. Okay, so you see, those are the kind of things you'll be doing there. And these people will come to you, and as an expert, they look at you as an expert there because they don't know much in there. At times, they'll take two scopes and show you and say, Charlie, which one is going to be good for this? And I said, what case are you doing? You say, okay, it's a nose job. Then they said, this retractor. At times, they don't know it. You tell them the name, they will even tell you something else. So you have to be confident enough to show them that, okay, I'm the professional here. Don't look at the doctor. Don't look at whatever position the person came with. Do your job there and let the person get the right thing. All right? Someone should take the second bullet for us.
Ensuring the needs are met for optimal patient care.
That's it. So that was what I did with a guy. I had to make sure that the first cases were going to have what they needed for the patients. It's nothing new. It's not written anywhere in any book to tell you this is what I should have done with that guy. But he came in, and okay, if I'm a consumer at this point, I'll need that this thing should be right in that room for me, not in the room that is not going to need it. All right? So we have to just switch it around, let them get it. And then the other room was even for a second case, which means that even if the instrument was not enough, there could be a quick turn for them to still get the instrument for the second case. All right? So I was ensuring what I was doing there, I was just ensuring that needs are met for optimal patient care. Okay? It's not a big deal. It's not a big thing to do. It should be a second nature to you when you get there. All right? So the next one says the impact of quality on health and safety. Someone should take the first bullet under that.
Quality affects both patients and facility personnel.
That's it. So see that the quality is not just the patient and the personnel, which you are in it too. The doctors are in it too. We're in the same boat. All right? So it's not going to affect just the patient. It should affect you too. And that's why it's very, very important, because it affects everybody in that boat. Stakeholders, nurses, anybody in there is affected. All right? Because it's one facility, and that facility is us. Nobody will stand out and say that, oh, it was this department. No, they'll say it was that facility. All right? Someone should take the next one.
Direct correlation between quality service and patient outcome.
That's it. We see that. This is not mathematical. We know we do math correlation in mathematics, but this is not it. It should work directly. Okay? Quality service should be up there. Perfect, consistent. It should go the same way that we want. It should not be going the opposite way when it should not be going north when we are going south. We both going north, we're all going up. That's it. All right? So it should correlate. Okay? The quality service and then the patient outcome, so that if we're giving them the right quality, their outcome should also be right. Are we all there? Their outcome should be right because we're giving them the right quality. There's no way we're going to give them the right quality and then their outcome will be failing. No. But remember, if you give them poor quality, their outcomes will fail. They'll be getting poor outcomes. So we need to give them the high quality so that the outcomes are also as high as we want. The next one says, what we, the technicians, our role in healthcare facilities. And I always call you no technician, but a professional. All right? Your role in healthcare facilities. Someone should read for the first bullet under that.
Accessing medical devices for various healthcare settings.
That's it. You see that thing has come up again. And in this job, the things that you see, they keep mentioning over and over, they want it to be second nature with you. I said one hospital that I went to had 80 different clinics, 80 different clinics, bringing instruments into that facility for cleaning, for sterilization, all right? So that you see that apart from that hospital itself, 80 additional smaller facilities are bringing it to you. So consider a hospital to be, maybe if you look at the departments, maybe you have 20 departments in there or 20 ORs in there. Another 80 are bringing stuff to it, making it how many? 100. You see? So it's very important. It is very important. All these people that will go into these surgeries are dependent on your quality of work. So processing these medical devices for all these settings should be a priority to you, that I should be consistent in my quality. I should be consistent. Consistency is the key here. Don't do it today and fall in a relapse tomorrow. All right? The next one.
Handling complex surgical instruments.
Yep, that is the key now. Every day we see new instruments coming in. Some look like plastic, but they are not plastic. Some look like knives, but they are not knives. Some are metal, but they tell you it cannot go into heat. Some are plastic, they say put it in heat, put it in the steam. Because you just see it as plastic, but it's not plastic. there are new materials coming out for surgical instruments. So follow the information for use. That is going to be your priority. To handle this complex surgical instrumentation, always pay attention to the information for use, which all professors have been telling you. All right? Good. So the next one tells us challenges and rewards for CS personnel. Someone should take the next bullet under that.
Emerging antibiotic resistant bacteria.
That's it. Antibiotic resistant. Remember, before if they were giving you like 2 ounces of some medicine it's working, now we have an antibiotic. We having diseases that take more than the 20 meals that they were giving you. They get so resistant that the 20 is not even taking care of them anymore. All right? And it's emerging because they keep doing more research. And they've seen that there's an emergence in the antibiotic resistant bacteria. So we need to find some super antibiotics then to kill them, which means that we have to be very, very careful with the work that we are doing now. Our processes have to be updated every time to take care of this resistance that is coming up. And so you have to be careful when they come and tell you, oh, this thing that we set for the parameters for 270 degrees Fahrenheit for 4 minutes exposure and 30 minutes dry, we need to change it to 275 for 5 minutes exposure and then maybe another 30 minutes dry time. You don't have to challenge it because you've been told here that there is an emergency now. That this thing that is emerging is going to be a problem because it's going to be resistant to the system that we have right now. If it is resistant, then we need to push further. So it will crop up. It must not be new to you. If you also hear of things like that happening, you could ask your manager, I just read in this bulletin that they said, oh, there's a new virus doing this, that. How do we take care of that? That is also good. That makes you up to date. Your manager also go and research it quickly and say, oh, maybe we need to do these things. In case we get this case here, how are we going to solve it? So that as soon as we do those things, we are going to be abreast with time. So don't say that I'm a new entrant, so I'm going to just watch things. You have to also listen to things and also have to explore because there is this emerging antibiotic-resistant bacteria. All right? It's not part of your job directly, but it's good that you know it so you can be the professional that you're supposed to be. The next bullet says increasing complexity of surgical tools. I keep telling you now, some tools, they look like plastic, but they are not plastic. They look like metal, but they are not metal. All right? So you have to be paying attention to all that. Then we now talk about quality indicators. What do we know about quality indicators? Can anybody say anything about quality indicators? What do you know about it? What do you know about quality indicators? Does anybody know that? Okay, it's just like going to be a measurement of your quality. What is going to make you see that or know that, oh, I'm actually meeting my quality standards? An indicator is supposed to determine whether you met it or you failed. All right? Whether you met the standard or you failed. And that's why it's going to be an indicator. It's going to indicate to you that this is a pass or this is a fail. But to do this, to keep in this quality levels that you want, which we say that it should be consistent, you need indicators. That is always going to be like measurable standards for you and a guiding line for you that, oh, I'm doing it, or I'm failing. All right? So you need to establish quality indicators as an individual, as an SPD professional, and as what is it, like a parent. You have to develop quality indicators. Say that, oh, I should be able to do this with my kids at home. They should be able to get to this level. They should be able to do this. Those things, you have to set them up. The same thing applies to SPD. When you are going to work, your job has quality indicators there that you have to look at. All right? It helps you, it assists you in monitoring quality within the department. And the goal is to ensure high quality patient care. All right? And to do that, you need to achieve it. And to achieve it, you have to have a comprehensive training program like the one that you have right now, and also on the job when you get there, which is going to be the ongoing quality monitoring. as soon as they look at this observations, as we said before, they should be able to tell you that, okay, we are not doing good in this unit. Maybe at the decon we're doing okay. The packaging, we're not doing good there. So we have to look at that unit and see how we can improve it and ensure that the quality is good. Because take it for instance that wrapped instruments keep coming back with holes in them. You did your work right, but maybe somebody dragged it either at the OR, not from your side. It went there sterile, but somebody dragged it instead of lifting it. Somebody just pulled it, and then it got perforated somewhere. All right, so we have to find a way to solve that thing. So we could say that, okay, we've observed that this is happening. So what are we going to do? Maybe we're going to call an in-service, and then we are going to involve the OR personnel. Now, look, this thing leaves our side still intact. But we've been getting this issue here whereby things are getting perforated. These are the reasons why they get perforated. If you pull them, you drag them, they'll get perforated. So we're doing this in service and wanting you to know that please, when it gets to you, when it gets to you and it's intact, that means not compromised. Please don't drag it, just lift it when you're opening it so that we can minimize these perforations that's going on. Are we all clear with this scenario? Okay,
Yeah.
so it's just going to be on you as you go. You're just a worker there, fine, but these things are going to be happening. And when you grow up in the system, get to the next level, you should be using it too. All right. So there's also going to be like ongoing quality monitoring, which is the observation. You have to observe too. Don't say that I'm a bystander. No matter your level in there, the safety is for everybody. Any questions? So quality in central service operations. Understanding quality in the central service is what I've told you all this time that we've been here for the past 30 minutes. Okay? There's nothing new they're going to tell you again about it. All they're going to tell you is that the patient is the center, and you have always to look at it as me, as a tech now, I have to look at this situation as a customer or as a consumer. And that is the only way you can ensure quality. But if you don't look at it through the eyes of the consumer, it's going to be very difficult. You only look at it as a job, it's going to be a no-no. You're going to fail miserably and maybe hurt yourself or maybe get yourself in some risk, okay? So don't look at it from that perspective. Look at it from the eyes of the consumer. Quality should always be consumer-centered, and that way you protect yourself. Then you protect the consumer too. See that it says understanding the quality is evaluated from the customer's perspective, as I just said. Look at it through his eyes. Look at it from his point of view, okay? But since we've all been sick before, we've all been to hospitals before, we can relate to this. So look at it that way. Put yourself back someday that you were sick and went to the hospital, or someday that you took your child to the hospital. Look at how you were feeling and what you were expecting. All these writings here cannot even tell much. They can't do justice to it. But that moment that you were in the hospital with your child, it does justice to the need for quality in the central service operations. Any questions? The quality relates to the degree of excellence of a product or service, which we all know. Even when you're going to buy goods, you know which one you should buy. I went to the fruit stand and I was buying bananas. I went and met a lady also from the hospital, another hospital in Scrubs there, buying also looking for bananas. So I waited because I met her there. He said, "Oh, you can take what you want." I said, "No, I want you to finish." Because he was going through all these bunches of banana there, looking at this. I don't like this one. I like that one. I don't like this one. So I had to wait for her to pick the 5 fingers that she needed. And it's all about quality. She doesn't want any messed up bananas. She wants a quality banana to get out of there. This, by the way, but that is quality. Okay, we always look for that. Especially when the women will go to the market, you should follow them and see how they do to get this vegetables and follow them and see it. You understand quality if you follow this woman to the market. All right. So quality is quality, quality, quality. That's all we're going to talk today. And then the importance of the patient-centered quality. It says properly processed products must be provided when needed. When needed. That is the key here. Don't provide it when it's not needed. And so when you go to work, they'll tell you that, look, this is our schedule here. These things are needed before tomorrow morning because the first case needs this, the second case needs that, the third case needs that. They need this thing when needed. They want them when needed. And that is where your quality should be. You have to give us quality instruments when needed. Don't give us quality instruments when we don't need it. Then you take your time and clean them and wipe them and let them shine and sterilize them and give to us when we don't need them. No. When we need them, that is where it's important. All right? Improving quality in CS operations. Increased education, which I said that we could call in for in-services. That is no new thing if you tell your manager that, manager, I think our in-services is maybe too relaxed. We need more in-services. It's a good thing. Ask your manager for it. Increased education helps staff provide higher quality service. So you can call for it. Don't wait. If you see that things are not going right, ask questions. If individual persons there can help you, tell your manager that, manager, can we have in-service over this? Because I can't get the quality that I want to get. I've been told that we need quality here, but this is blocking me from doing it. Call for it, because I'm telling you here, and the book is telling you that increased education helps staff provide higher quality service. Okay? Any questions? We're going back to the customer perspective again, because I said quality. It's there's the saying that what it says what beauty lies in the eyes of the beholder, right? And this is the same thing we do here. If we talk of patient care, it's in the eyes of the customer, the consumer. And I've told you that don't look at the day that you were sick and you think that you were dying. You think, oh, I need to see a doctor today. I need to see a nurse. I'll be good to see a nurse. All right. That is where you should look at this, the need for quality in healthcare. All right. So there's nothing new they're going to tell you. It's the same thing again. Definition of quality here. Everybody knows quality, but look at the definition that they're giving us. Is the degree of excellence of a product or service. Example, efficient emergency code delivery, but missing items indicate poor quality. Look at it. I said, okay, the doctor has a sinus case. The sinus tray has over 109 instruments in there. And then you wrap these instruments, certain things are missing in there. You didn't take note of it. You wrap it like that, forget to put an indicator, send it to the OR. They open it, no indicator. That's the first thing. Okay, they bring it back. They take another one. They go and open it. It's incomplete. But there was nothing indicated that it was incomplete. This is a failure. Because our system is such that instruments that are incomplete has to be noted on them. And the indicators have to be in there. So if we submit this when it's needed and it gets there and it's not to the quality that we want, that is a complete failure. This is just a practical example that I'm giving. And then prompt delivery, it should be there when needed. All right? Don't tell me that the case starts at 7 and the instrument was not ready until 8:30. Every minute counts. Every minute counts. So when they come and tell you we need this, we call it start. When they tell you that it's like ASAP, I need it right now, the next minute, it has to come. There are times in my floor, I'm on the second floor, we have an SPD at the 4th floor. So the instruments are more located in the 4th floor. So when they need it, maybe the patient will be on the table, they're working on, they need it. They come and tell you we need it, or call on the phone, you need it. Whatever you do, you have to stop it and go get it. Make sure the room gets it as soon as possible. All right? And that is what we talk about as prompt delivery. We need to do that. And then patient-centered quality. I spoke to you about that already. So I'm not going to hit on it again. Improvement strategies. Customer perspective. Review process for improvement. That is up to us to be doing it. And our managers will be doing it most of the time for us. But we should not just walk there. If you see a problem, tell your manager. Those are the kind of things they will have to know in order to improve strategies. That, oh, this strategy is not working anymore. Let's change it. You say, why do you think it's not working? Okay, this is what I've seen here. Maybe today I did this, it didn't work. So maybe let's find a better way to do it. All right? And then he will understand it. But if you sit and don't tell them, a lot of time they don't see these things because they are in the office most of the time and you are in the decon and then the clean side. So there are things you see that they don't see. Staff education is always a must. It says that, oh, director, please give us some orientation. Maybe if they're giving it to you every month, Tell them that, can we make this maybe every 2 weeks so we can learn better? It's good. You could ask for it. All right. And what I know and what the book also confirms is that quality efforts requires time, effort, and participation. You have to be involved. Don't be a bystander. You have to be involved. Okay. And then when we're measuring the quality, it's from the best practices as we do. That is the starting point of quality. Taking your time to assemble the tray, making sure that those that are not functioning properly are more greased and clean to function very well. Testing the scissors to see how sharp they are. Everything. That's where it starts. That's the starting point of best practices. All right. And then the components of a quality program, central service quality program elements. We talk about all that. But even though there are more of literature to you, you will need it because you see certain things that relate to them and you have to look at that. Identifying quality. It's quality, as I'm saying, we said that beauty lies in the eyes of the beholder. It's more subjective. It's more subjective. All right. So put yourself, the time that you were sick, I'm going to keep reminding you. Put yourself in there. And that is where you actually can see it very well. Where and what and how quality should be. How quality should be. All right. Yesterday, a friend was telling me, oh, my neighbor was sick and she nearly collapsed. So I had to hold her. And then as soon as I held her, she said, oh, call my husband. I'm dying. I'm dying. And I said, is she dead by now? He said, no. I said, why was she saying she was dying? He said, I don't know. She was passing out. And when I held her, he said, call my husband. I'm dying. So I said, okay, afterwards that she didn't die. What happened? When you went to her, what did she say? He said, oh, well, when I went and asked her, why did you say you were dying? He said, I was so weak. My body it was like I felt I was done. You know? So you see, look at that situation. So this woman at that point, what do you think she was expecting? She was expecting all the quality and help that she could get on earth at that point. And that's what you are going to offer. That is what you are going to offer. Okay? So it's a very subjective. Subjective meaning the person needing it is the one that is going to assess it or judge it or tell you whether it was good or not, or show up to say that it was quality or not, for her to fail or pass. All right. Branding and quality. You know, we have clothes that are Nikes, what is it? Louis Vuitton. You know, a lot of clothes and brands. They all come with their lines and we know the quality. The ladies, tell me 2 qualities of clothes that you have, or maybe perfume or anything. Any lady to tell me any quality of perfume or clothing line?
Sorbet bag.
I've never even heard about that. You see? Imagine that. You see? It's a classy brand. And that is what we have to do. We have to brand ourselves. We should be able to give that consistent quality. You see, it doesn't matter. Those big names don't matter. You see, a new name that she just mentioned to me is a new name, but it means that that company is doing good. Consistently, they're coming out with something that has a quality that these ladies want. And so they want it. That is the quality that we should set ourselves for and set our SPD for. All right? So branding and quality, positive experiences lead to future purchases. So just that she just mentioned it, don't you think she's going to go buy it again? She's going to go buy it again. So long as she can afford it, she'll go and buy it because she wants that quality. Okay? Objective quality measures. Products should be complete and properly assembled. Our instruments must be complete and properly assembled. In some cases, some doctors, I have a doctor at my end who says she doesn't like those the instruments with shiny finish in the stainless steel instruments that look shiny. She doesn't like it. I'm not going to mention this, but he doesn't like those instruments. So his instrument sets are all those dull ones, dark, like not shiny. No, he doesn't like them. So look at it this way. He wants a complete and properly assembled instrument, but he doesn't want the shiny ones. So if you go and give her the shiny ones, did you do your job right? Did you do it right? She has her own reasons for not liking those instruments. I don't know what it does to her, but she has her own reasons. I think she works better with those that are not shiny. So we look at that and give her what she wants. We're ensuring quality service. All right? Internal department systems should ensure no errors. So internally, even within ourselves, that's why I say that the aseptic rule, the number 5 comes in. Whenever you see anything, don't stand and say somebody did it. You have to go in right away and correct it. No complaints. Don't complain that, oh, he did it, so let it go. No. It's about the facility. It's about the SPD. So go in, correct it, and later talk to the person that, look, this is what you did. It was wrong, but look at it. I corrected it. Next time, make sure that doesn't happen. All right? So the internal department system should ensure no errors, and that is part of us. We have to, as per the aseptic principles, the number 5 of it tells us that when it happens or there's an error, don't look at and point fingers. Intercede, go in right away, correct it, and then later on you can talk about it. Any questions? Now we're talking of components of quality. It says quality is a long-term commitment. You see, so when I talk of those, the consistency that I was talking about, it's supposed to take you long-term and supposed to be consistent for that long term. Supposed to be, you see, even now, like cars, when it comes to cars, you talk of, I know the men would rather talk of cars than the women talking of other things. You talk of cars, new companies coming in with new cars and new brands and what have you. But the point is that some cars have been in the system for years and they have a consistent quality. They have a consistent quality. And so people that look for quality want to go for those cars. Can anyone tell me any car that has that kind of consistency? Like some quality component that they've been keeping all these years.
Honda,
Honda,
Mercedes.
yeah. What about Honda? What has Honda got? What are the good things about Honda?
durable,
Uh-huh. What again?
the horsepower.
The horsepower. They go fast, right?
Yeah.
And they're easy to customize too, right?
Not really.
No, really?
No.
Oh, so which one again? So Honda, they have their own brand name. Okay, which other thing? Which other company?
The Toyota photos.
Okay. See, they all have their qualities, right?
Yes.
And the quality has to be consistent. There are other ones that if we talk about, it's like nobody want to hear about them because they don't have the consistency. Today they are good. Tomorrow their next car comes out is the worst. Then the next time they come with another one, struggle to sell it. And another one comes and it's up the chart. Then after that, they come with another poor one. That is not consistency. People will not rely on that. We want consistent quality. All righty? So if we're talking of long term, that is it. Be committed to providing the needed consistency for the long term. Not just because I'm here to steal them. I'm here, but I'm going to do it. Today I can do it. Tomorrow, no. Our quality should be consistent and should be consistent for the long term. Achieving world-class quality requires a multi-year plan. So you see the image that you see there, they're planning something. It's about a multidisciplinary disciplinary team where you have people from different levels, but then you guys meet together to work and plan together. Because every stakeholder in the system or every member of that system can contribute to something. The leadership cannot sit up there and decide and give it to you that, oh, this is what we've decided. It's going to work, but it's not going to give us the perfection that we want. All stakeholders must be on board. Okay? So an example is they use Ritz-Carlton's hotel, the 6-year process to reduce defects. Companies do that. But if they're thinking of reducing defects in the hotel, right? Do you think that management can just sit up and decide by themselves and get everything right? No. They need the housekeeping people. They need the cooks. They need everybody to come out. Let us know the processes. What is lacking in our processes? Where are the problems that we're facing? Why are we going down? What are the defects? The director cannot sit there and get all that. We need to give that input. And that's where you are important in there when you go in. Note everything. Take note of everything. Observe everything. And when it happens, maybe you'll be on one of the teams to be able to help us ensure that quality is consistent and it's long-term. All right? Because there are millions of transactions that will come through, millions of patients that will come through. So why can't we think that it's going to be bad if our quality is not good? And for that number, we have to ensure that there is safety, there is quality. Because we could be one of those numbers, or our loved ones could be in there. If not, our friends and colleagues also have loved ones who could be in there. So in any other way that we look at it, every other way, it still affects us. So look at this company, they were looking for a 50% reduction in cycle time. So it means they were having a whole lot of issues. To look at a 50% reduction means they were having a whole lot of issues. Maybe it was costing them too much. Because at times, such plans are made for like, oh, let's do a 10% reduction. Then another time, let's do another 10. But look at that. One time they were looking for a 50% reduction. That was a big thing. It looks like they were struggling. Okay? So the importance of top level support is just to make it happen. They have to come in to make it happen. But you are on the forefront. You are the frontliner. You see the problems more than they do. So what you say is going to be more realistic and more practical. But what they say has more weight. But then you feed them with what you see. It's their job to analyze what you fed them with to come out with a decision that will eliminate that problem or address your concerns. All right. So they are important, but you are very, very important when it comes to looking for this kind of concerns to ensure quality, because you are at the forefront of it. So quality, as I said, the multidisciplinary approach, quality should be both multidisciplinary and intradepartmental. So somebody at the OR, somebody at the SPD, somebody at the risk management, somebody at the scrub techs, everybody, the surgeons, everybody has to be, there should be somebody from all those units in that team or that committee. All right. And that is the only way you can ensure quality. If you don't get everybody coming up together, you cannot see all your problems to take out the problems so that you can get this quality that you want. A long-term quality plans, as they put in here, improvement is not just a quick fix. That is something you have to understand. It's not going to happen right away. It will not happen right away. It requires that multi-year plan. So the directors will have to do that. But then it's up to you to always notify them the things that you see, the things that are blocking you from delivering, and the things that you think should have been done better. You're not going there as just a new entrant, but you are going there as a human being who has grown over these years, who have gone to the hospital several times. You've seen so many things, and you've observed things that you think that should have been done better. Use all that, not just the book. All right? It should be an all-round thing. Any questions at this point? Okay. So looking at this thing, when we say that the cycle time reduction that they were talking about, we see the 50% they were looking for in the cycle time was relevant to both hospitality and healthcare, which is good for us. If we're able to cut down 50% in our cycle time, it's good for us. But the point is, what is the quality of your hospital? The quality of your hospital will determine that. If quality is getting bad, then you need to even do more. But if it's good, then you have to be consistent and try to keep it as it is and improve. All right. So even though this is more of technical things they're telling you, it's all patient-centered. The top level administrators will have to do this. They have a critical role to play. Support from that level to you is going to help us take care of these problems. Most problems affecting employees and their work are due to systems and procedures implemented by the top level leaders. And so they have to be involved. But then you are having that problem because of them. So if they don't come and tell you, they put it there thinking that it was good, but it came to you and you realize that it's not good. It's not helping my productivity. It's not helping my quality of work. And so you have to talk about it, because most of these problems, they have put it up there, not as a problem, but when it got to you, it's a problem. So now you have to talk about it so that they can rectify that. And then the departmental quality also hinges on that too. That work has to also involve multi-disciplines and multi-departments. Don't sit in your department and think that you can solve all your problems there. No. As I said earlier, that this guy came to me from the perioperative section, telling me, hey, Charlie, I need this, that. And I said, okay, you need this instrument, you need that instrument. I don't have any on my system right now. I know I have 3 sets. They're all out there. So our next step was to go out there, look for the 3 sets, whichever rooms they put them in. And what we found out was that the room that they even set them up for, when the equipment, they don't even use those instruments. So we don't know who put them there, but then we had to react right away and try to switch some of the instruments around to make sure that they went to the appropriate rooms so that quality service is actually going to be achieved. Okay, so those are the kind of things. So somebody sitting up there may have directed that, but look at it that way. Practically, it wouldn't work. So if there was any way I could comment to them, I could tell them that this thing that you put here doesn't work because that room doesn't have this capability. So next time, just make it clear that they don't have to take that over there. Or maybe let's put a note on a device that as soon as they scan to that room, it's going to tell them this thing is not compatible with that room. All right? Those are the kind of things that will happen. It's practical, as I told you. Okay? So if they come to you, don't tell them that, oh, you are not in my department. You need them and they need you. The scrub techs need you. The surgeon needs you. Everybody needs you. All the departments need you. Okay? And the customers too. Any questions as at now? Any questions? So now let's look at empowerment and leadership. Empowerment is more about, technically we talk of delegation and stuff. Delegation is like your director gives you permission to do certain things or go and take certain actions with his authority. He's giving you the authority to go do it. All right? Okay. Here we're talking of empowerment, where the department or the facility empowers you to a point. They train you to a point and tell you at this level, when this situation happens, take authority, do this, correct it for us so that work can be smooth. They have trained you to a point that they have enriched your quality at that point, and know that even if they tell you go do this in our absence, you can do it. They have empowered you already. So that even though you are not in the leadership yet, they've given you the training and quality that they think you have been empowered enough to take certain decisions that they would have taken if they were there. All right? Even though it may not be management decisions, but just as I told you that I had to go and go with the nurse to go and check certain instruments that were not compatible for one room. Maybe before I would have had to call my manager, say, manager, hey, what is this problem here? How do we do it? But at that point, I had been empowered enough to know that, oh, this thing cannot work in this room, so we have to go to this room so that we can get the first case here handled properly, and the second case here gets the instrument afterwards. You see? So empowerment is very, very practical, that you should be trained to get to the quality level that we need you to be. And there you can be delegated to do stuff. And you have the authority to make decisions there at the level that you are. And that is why we said it's necessary here. So it shifts, when we talk of that empowerment here, as the book is telling us, it shifts the decision making to supervisors or frontline staff like you and me. Okay? Traditionally made by managers or higher level staff. They can tell you, like my manager, when he's going to say, Charlie, take charge here. And I look at him and say, what? What are you talking about? He say, take charge, I'm out. The director will say, okay, can you do this thing? I know you can do this. Now put it this way. Charlie, do it. I'm out of here. Okay? They have empowered me to that point. So you'll be empowered to do certain things. Take it up, or you need that empowerment. All right? So you'll be getting a lot of employee training for empowerment. That is a manager's job, but you can also ask for it so that you can also get yourself so invested in there. Because if you're taking this as a career, don't take it as you're going to stay at one point. Take it that you're going there to go forward, to progress and get to the point that you actually cherish to be a director or something one day. Don't just go there that you're going to stay there and stay at the OR, at the Deacon or processing center all your life. No. It's a career. Take it and make sure you're going to progress through there. And that's why all these are coming up now for you. Okay? Role of leadership, you know that. They are committed leaders. Then they manage data and plan opportunities. Fine, that is their job. But then you have to take advantage of these plans that they bring out. You see some data that you don't understand, ask them, what is this data for? And they'll tell you this data is for this, that, and show you how to read it. Then you are bettering yourself already. You are even empowering yourself. Establish priorities and empower people. That is what they're supposed to do. One day you'll be doing it. Now, knowing that they're supposed to do that, you can also call for it so that you can get empowered. All right? They have a lot of responsibilities, but at times, if they are not doing it, please, since you know it, call for it, ask for it, so you can get it, take advantage of it, because you have to be up there one day. You're not going to stay down there all your life. You must plan to take it as a career and to take it forward. And one day you'll be making the decisions. Any questions? Okay, looks like we're moving smooth today. It's all about leadership. I'm even going to skip this. It's committed, manage data and plan opportunities. That is their job to do. Establish priorities and empower people. That is their job for leadership. When you get there, that's what you're going to do. If you're not there yet and you're not getting it, ask for it. All right? They define the standards to be set there for quality product services. They develop strategies. That's why they call you when you make a mistake. They call you to talk to you about it. They develop strategies for customer satisfaction. If customers get something that isn't good, they report it back to your director. He calls you, or your manager. He calls you and says, hey, I saw this instrument with your name on it. It was dirty, or it was incomplete. Okay, or it was improperly labeled. They'll call you for it. But the point is, that is their job, and it's up to you to also follow it. They are there to supervise you and make sure the quality is consistent. But then you see that your involvement comes in. You have to help teammates follow guidelines, interact with new or less qualified staff. That is what I always tell you. Ask questions, ask questions, ask questions. Don't just sit and let them do things, or you do things the way they're doing it. Ask questions. There are standard data and planning tools that the leaders will be using, like quality planning. Is the importance of it is that it reduces existing problems. They have to be using that. But you take, all I'm saying to you is you take advantage of that at this level. You see that the image that you see, average trays that were logged in at time and everything. Data is of so much importance at this department. Time, how long it stayed, the time it lapsed, the time it was started, the time it ended, how the indicators, whether they passed or failed, the type of indicators, everything matters here. And even the testing of the machines in the morning, the autoclaves and the washers, they all have to be documented. And it's based on this quality, data, that planning is done. And then we get the benefits coming out, because we're able to plan to adjust certain situations to get the ultimate that we always want. That is up to them at that level, but then we should know about it. And they need tools and procedures. They need to study these facilities and then understand how they deliver the products and services. We will get to it where I'll be giving you some of the tools and other things that you may not need now, but definitely you may need it as you go on. But for now, you may not need it. But then you need to know, okay? So I'll talk to you. I'll go on and let you guys know about that later. The principles of quality management, the foundation of quality process. Focus on the process, not the people. And that is one thing that we always talk about. Quality management. The focus is on the people, right? The focus is on the process, not the people. So if the process that we are using to actually take care of the instruments, it's not good, that is where we have to look at it and say that, oh, our quality process is not working because our process has failed. Maybe we're taking goods from the decon and then our washer is not doing it good. So now the instruments come out from the decon and they still have stuff on them. Say, okay, we've followed this process for years. Now it's coming through the same process, but the instruments come to the other side different. So now we say that, okay, let's focus on this process now. The process is still good. So how come the instruments are not coming out good? Now we look at the washers and say, okay, is the washer that is not performing right. So now either our instruments have gotten so updated that our washers are not good enough for them, or maybe somebody is not cleaning them right, or maybe the detergents we're using are not the right ones now. All right. So you see how it is now. The quality management should focus on the process, not the people doing the work, the process itself. So if they follow the process, they will know that, oh, we need to update this, or we need to change that to make sure quality is ensured. Okay, because most problems, as we know, arises from process issues. And that's why they said that the foundation of quality process is actually on the focus of the process. You have to focus only on the process as at the point, not the people doing it. Because most problems arise from the process. And that's what I just gave you a practical, a realistic example of how the goods that were coming out before were good, but now they're not coming out the right way. All right. Steps of quality planning: identify customer needs and requests, which we've spoken about, putting ourselves in their shoes. Develop an ideal process to meet their needs. That is the work of the leadership at that point. Compare actual steps and outcomes to deal with. That will make it ideal for you to say that, okay, now this outcome is as what I want. Okay. But if you're not able to do that comparison, it's going to be a problem assessing whether you achieve something. To compare the actual steps and see if they're ideal to work. Then plan the process, control activities for improvement. You can't just put the process there and not control it. It's new. People are going to skip a lot of things because it's new. They don't know. They're not doing it deliberately. So if you put it there, you need to have control activities there. Maybe be next to them for a couple of days, letting them go through all the process, giving them in-service and everything that you need to give them. All right. But remember, everything is patient focused. All these processes that we're focusing on for management, for quality management, it's all about focusing on the patient to get the patient care that we want. Process management, continuous quality improvement, and all that, I'm going to tell you more about it. Okay? And fact-based decisions, I'll tell you more about that too after we come from break. So quality management principles here. It's almost the same thing that we just said. So I'll even skip this. The focus areas, I've told you about it. It's mostly the patient that we're thinking about, but then the process is our number one foundation for quality management. So now it's talking of the steps of the quality planning. Outcomes of each process, as I said before, you have to compare those outcomes and see that are we meeting what we actually targeting? Striving for ideal outcomes, so that as 100% error-free trace come out, we can say that, okay, now we set this bar and we met it. So the steps are there, but then if we take the steps, we should be able to always compare to be able to see that we are striving for an ideal outcome. Everything must be fact-based. And that's why we need all those data and all those recordings. Making decisions based on facts rather than assumptions. Don't just assume it. Look at your numbers. Look at the quality of stuff coming out. Look at the processes, how they're working. And based on those facts, you can tell us that, okay, now we've seen quality. We've reached the level that we wanted. Don't just assume it. There must be some statistics to it. All right? Then you plan the process and then the control activities. Step 4 is planning activities to improve the system. But that is up to us to be so involved. And as I said, it's not one department. All stakeholders must be on board. The scrub tech, the nurse managers, the nurses, the surgeons, all those perioperative departments, even housekeeping must have somebody in there. And that way things will go up. Housekeeping, why do you think we need housekeeping? They clean the floors of the OR, they clean the floors of the SPD. You cannot go and do extermination in the SPD as a tech. You need housekeeping to come and do anything in case you find anything there. They have to mop the floor, they have to wax the floor, they have to do, and they have to use the specific qualities of detergents that we need. So you have to involve them. And that is how I'm saying that it's very critical that all stakeholders, at our point, all stakeholders must be part of our decision making there. Planning and quality management must involve all these stakeholders. So when you didn't see anything like that, advise whoever is doing it that, look, at this point, we need everybody, because everybody is part of the quality that we're trying to put up there. So no matter how they plan it, all stakeholders must be there. And that is something that we've told you here, so I know you're going to push for that. Staff members' role in the quality, staff engagement, that's just what I'm telling you now. All departmental staff must be fully engaged. Technicians play a key role in achieving success. Management's role is there. They set the standards, fine. But then we are going to give them what they need to go and set those standards. So we need solid education, and we need to ensure critical thinking skills. And as I said, you are of age, you all think critically, but now you have to think more critically as you go in there. Why? Because I've told you that people don't come there in comfort. They come there uncomfortable and they have their expectations. You've ever been sick, you've ever been uncomfortable, you've ever called for the service of a doctor or a hospital. Look at the situation that you were in at that time and what you were expecting. That's what every patient expects. To look at that as your guiding, as a parameter for you to always set your standards. That look, if I was there thinking like this person coming is thinking that same thing. So I have to make sure he gets that. Now that I have the opportunity to do it, let me do it so that he can get what I was expecting when I was in that situation. Any questions? I know you relate to this very much because this is more practical, as I told you. So I know you guys are relating to it very much. It's not going to be a difficult thing. Even though the slides are so many today, I know we will do it in good time since it's very practical. And so far, you guys are relating to it. Just knowing that you've ever been sick or your child has ever been sick, and then you are putting yourself in that moment to see what you were expecting them to do. At times, like if you had a fracture, you were expecting that the doctor could just touch it and it will heal right away, which is not possible. But that was what you were expecting when you had it. Okay? That's the quality you expected. But that one is not possible. Don't even think that way. There was no magic he was going to perform for you to get your broken leg fixed right away. Okay? But at least you had that expectation that I need quality service so my leg is going to heal. And if I was playing soccer, I should be able to play soccer again. All right? Any questions? Any questions? So who are the internal customers that we serve? Can anyone tell me the internal customers that we serve?
OR.
Good. Which one again? Which other customers?
ER.
Yes, we have the OR, we have the nurses, we have the surgeons themselves. We serve them. They are our customers, okay? And we give them what they need to be able to give the patients the care that we are planning for to make sure they get the perfect care. Even if it's not perfect, the best quality that we can give them, okay? So I know everybody is following because we have to enable these caretakers to offer their best. If we don't give them, they cannot do it, all right? Imagine the doctor goes to the OR, you bring the first instrument, no good. Second instrument, no good. What is he going to do? There's nothing else he's going to do there to save the patient. Nothing. He can't improvise anything there. He needs a sterile instrument, not non-compromised instrument to use. There's nothing for him to do there if he goes there. We don't give him that. So we have to make sure he gets that so that he can actually do what he's expected to do. So with us, our pledge is to make sure that consistently trays reach the OR sterile and perfect for the job. That's what I pledged myself when I started this job. I pledged myself that I'll try as much as possible consistently for my trays to reach the OR sterile, not compromised in any way. That's my personal commitment. So I do my best. Sometimes it takes me time because they may be incomplete and I have to be looking around for the missing instruments to put them in. But then the thing is, it's about quality. So at times I don't even worry about the time. And remember, some of the cases we are giving the schedule today and then the cases tomorrow. So we have enough time to get it ready. And when we don't have it, we call for the other hospitals to bring them. All right. So that is a pledge that I made to myself that you should also make to yourself. Make it to yourself that you can pledge to yourself that you will always give them like consistently quality instruments. You make sure you're watching everything carefully, not skipping anything, because what you expected when you were in the hospital is what you think these other people are expecting. So you just pledge it to yourself. I'll do everything possible to get it that way. Any questions? All right. So the quality control indicators, as I said, indicators, they are like measurements, guidelines that we are going to use to measure our performance and stuff. There are so many things. With this is going to be the last slide for us to go for our break. It says that the purpose of quality control indicators are one, to determine how well the department meets its objectives. I think we said it already. It helps us monitor or observe several quality indicators periodically, so that we say that, okay, this week we did 100 trays. Out of the 100 trays, 2 came out bad, that like perforated. Fine. Next week we did 100 trays. Only 1 tray came with a problem. Well, so we improved it. We got 99. Good. The next time we did it, now 0. Nothing came bad. Wow, we're doing good. All right. So we're observing it and we are showing that, look, our indicators are that we need to give perfect trays. And so far, I think we are meeting it. All right. So we observe it and make sure that we're doing the right thing. Examples that they're giving here is the start that I spoke about. I think it comes from starting, Latin word starting, meaning immediately or as soon as possible. Yeah. Now I think current we will say ASAP. I need it ASAP, right away. I need it right away. Okay. So when you see start medical supplies, they must be delivered within 5 minutes. And I told you, I gave you an example that they needed an instrument, a Nagahara is an eye instrument that we don't have on our floor. I had to go to the 4th floor for it. I had instruments that I was processing, but then I had to leave it and go right away to get it because they need it. As you see, start there, they need it within 5 minutes. It has to be there. Okay? It has to be there. So when you see start, it's a Latin word for starting. But then it's just about we need it right away. The next minute, it has to be here the next minute. It's just like I need it as soon as possible. All right? Only sterile supplies with current dates on unit supply cards. So you don't take any expired instruments to go to the OR. Check that. Acceptable sterilization process based on indicators. Fine. Our external indicators must all pass. Patient care equipment and supplies are available and functional. Don't send any faulty thing to the OR. All right. So these are things that we check. These are like quality control indicators that you have to look as your yardstick. All right. So now it's 4:17. I'm going to leave you here. We're going to pause for a break for 15 minutes. So we come back at 4:32 to continue. Okay. Is that okay with everybody?
Yeah.
All right. Yeah. So we're going to pause for now. And then we come back at 4:32.
Okay.
Alrighty. Alrighty, we're back. Okay. So as I was saying, the purpose of quality control indicators is what we have listed here for timely delivery of supplies, availability of sterile supplies. The supplies should be available. It's if they are not available, that's a problem. So the indicator should tell you that it must be there. If it's not there, it's a problem. That is no quality. Okay? And then acceptable sterilization processes. Our processes must be right, or else quality has been compromised. Proper instrument set. We should get the right instruments, or we have compromised quality. Patient care equipment. We should have everything that we need for the patient care. All right? There should be availability of instruments. There should be biological indicators. There should be correct contents in case cuts. You don't have a sinus case and you go and put a TNA instrument in there. You have a facial feminization and you go put a breast reconstruction in there. It must be the right instrument for the right case. All right. And that is where we can say we are ensuring quality control. So those are the indicators are more like parameters or measurements for us. Okay. So we have analysis of quality concerns. The first one you see there is a failure mode and effects analysis. This failure mode, take good note of it because most of the time it's on the exams. Most of the time it's on the exams. The failure mode and effects analysis. This was why I was rushing to get to this point because this is most of the time it's in there. And it's the FMEA. It originates from military and industrial fields. It identifies and prevents problems before they occur. Underline that if you have anything, write it. It identifies and prevents problems before they occur. So it's more like a proactive strategy, a proactive method, a proactive quality analysis. All right? That is one of the distinct features of the FMEA. And at times on the test, they'll ask you that, oh, the productive quality analysis that originated from the military or industrial fields. You have to go for this. Or it tells you a proactive quality analysis. It's the FMEA. Okay? All right. So that's a tip I've given to you for free. This is a tip I've given to you for free. Okay? Take note of that. And then it defines the topic to be addressed. That is the strategy. That's how they go by. They go on with it. They define the topic to be addressed. And then they assemble a multidisciplinary team. As I keep talking about, you cannot be alone. You cannot isolate the SPD. So to ensure this analysis to be right, the quality analysis, using the FMEA, they'll have to identify the problem to the topic to be addressed, then assemble a multidisciplinary, like multi-departmental, intra-departmental team where we can have scrub techs on it, the housekeeping, you, the SPD, the surgeon, somebody from the front desk, everybody is in there. Okay? So, and then this group will have to identify possible hazards and causes. But remember, I told you they are proactive. Proactive. They look ahead. Okay? They look to prevent. They are proactive. You have to take note of that. They identify possible hazards and causes, and then determine actions and outcomes for these potential problems. The possible hazards are like potential hazards, things that are bound to, that may happen. That may happen if you don't solve something, if you don't change something. Are we all good with this? I need some response from
Yes.
someone. It's proactive.
Yes.
Yeah, it's proactive. Noted. If it's on the test and you let it slip by, you're going to have a lot of issues with me if I meet you one-on-one. Okay? All right. So that is the FMEA, the failure mode and effects analysis. It originated from the military and it's proactive. Okay? It identifies and prevents problems before they occur. All right. Another quality analysis is the root cause analysis, which is the RCA. All right. So I've told you the first one was proactive. So look at the RCA. It says that's reactive process. So if the first one was proactive, and I said it does to look at potential problems, what do you think the root cause, which is reactive, what do you think it does? The first one looks ahead. What does this RCA looks at?
Looks after something has happened.
It looks backwards. Okay? Make it simple. So it waits for the thing to happen, then it looks backward. As he said, after the thing happens, he looks at the back and say, okay, like you're walking and you slip and fall, right? When you get up, what do? You look back. Is there anyone who has ever like run and fell and just woke up and went without looking back? This is very practical and realistic. Tell me, whenever you run and fall, the first thing you do is you look back. What happened? How did I fall? Okay? That's what everybody does. It's a second nature. So that's the root cause thing. You see that it's named root cause analysis, fine. But the point is, it's something that we do every day with us. When we slip and fall somewhere, we look back. Oh, what happened? Oh, that place was slippery. Okay? So it's reactive. It looks back to see why it happened. Okay? So that is a problem that you have to look at. If it looks back, the first one looks ahead, the second one looks back. Okay? The first one looks ahead, the second one looks back. Anything to tell me about now? See what they've listed now. So since it's reactive, it prevents recurrence. It makes sure it doesn't happen again. And that is the reason why when you fell down, you first look back to see why you fell. Why do you think you look back? Tell me, who can tell me why when we fall, we look back before we even get up? Somebody should tell me, just practical.
The cause.
The
The
adrenaline.
cause. Yes, and I sure. You need to know, whoa, so what happened there? Because you didn't expect to fall, right? You thought you were walking smoothly, you should be able to go where you're going. Then you hit something and slip and fall. So all the body is going to do is look back. What happened there? Why did I fall? So you're looking back to know why, so that it doesn't happen again, so that it doesn't reoccur. This you're not going to forget. Okay? So that is the root cause analysis. It pops up on the test a lot of times. When it pops up, you should be able to know what they try. They may trick you with it, but you should know it. When I fall, I first look back. That's the root cause analysis. I want to see why I fell there. All right? And why I want to see is that I don't want it to occur again. Are we all good now? So the key thing here is that it must involve all members, as I said. You see that the same thing that they keep rewording it. They call it interdiscipline, cross-departmental, intra-departmental. It's the key is that it must involve all members. All right? Those terms should not even confuse you. It must involve all members, housekeeping, everything. All right? Risk management, the doctors, all stakeholders in there. It must involve. So we've seen the failure mode, which is more from the military and the industrial fields, that they always look ahead. The military look ahead because they don't want to be shot. They want to shoot first. So you should not forget this. This should be something that you can remember all the time. They look ahead because they want to shoot before they are shot. And then root cause, you look behind because you don't want it to happen again. All right? Any questions? I think they should give you like 2 free questions. if they drop, they may drop though because they are very regular. Alrighty? They are very regular, so they may drop. Okay. So the failure mode that they first say is just telling you details about it, but I think what I've summed up should be good enough for you. All right? What I've summed up should be good enough for you. The process, the steps, they define the topic to be addressed. Then, like, for example, they say we want to replace the hospital boiler. They have to find a way. Okay, do we need something to replace it? Something like, do we need to rent something in case this one blows up during the replacement? You see? So they are assemble the group of people from different disciplines into a team. Then they actually look at what things that may go wrong during this replacement. Okay, they identify actions and outcomes. Maybe we should have a standby boiler in case this one it doesn't go as we want it. Okay, it's a normal thing that we do. If you are a very good planner, these are the normal things that we do. So the example that is giving you is like replacing, as I said, the hospital boiler. Okay, like replacing a light bulb in your house. All right. You call the super. Okay, I'm gonna buy the bulb. I'm gonna call the super. He has to come with a ladder or something to go up there. So if I have a chair that is strong, why I put the chair as a second option in case the super comes and he has no ladder. I have a chair that he can stand on and do it. I improvised. Do we relate to that? Does anyone relate to this? It's just a practical scenario I'm giving you. So that is how this team is going to work. But you are not there yet, but then you need to know it because sometime you're going to be a manager, a supervisor, a director somewhere, okay? So you need to know this. This is normal for your daily life too, to manage things at home and wherever you are. So this is how they do it. That's the scenario, okay? It doesn't have to take us too much time. Any question on it? Okay, the root cause analysis also goes this way. It's reactive. So it aims at preventing the recurrence. So, example, you have a washer disinfector pump malfunctioning, causing improper cleaning. The carbide is insert on a needle holder, breaking during surgery. Look at these two issues. So if you're using the root cause analysis here, this is what you're going to do. You have a surgeon there, a scrub tech here, a CS manager, the risk manager. They're all there in this committee. Okay. So now the surgeon is going to say, how was the instrument used? He's going to tell us how he used the instrument there during the surgery. Then the scrub tech and circulating nurse also say, oh, instrument check before use. When we checked, it was perfect. There was no crack on it. There was no line or anything. Okay. Then the CS manager also say, okay, these are the policies that I have at my place. If it's faulty, we are not putting it in the tray. If it's cracked, we are replacing it. So I don't know how come this thing came in perfect shape and this happened. All right. Then the risk manager will also say, okay, he's going to be the facilitator of the meeting. Okay. So far, you guys have given us all this information. So how did it happen? Which means that it's possible for this instrument to be losing the tip during surgery. Then we note it and contact the manufacturer about it. Oh, this thing didn't have a crack, but it had this problem. Is there anything that we can do to stop it? You see that we went back to the information for use now. Then they also review the information for use and see how to solve it. That is the root cause analysis. See how far we've gone back. Okay. Other interested parties will be also informed, that, like the instrument repair technician, the infection prevention personnel. We go back and make sure that we are going to stop the recurrence of this needle holder breaking during surgery. Any questions? All right. So quality program alternatives. You know, there are other alternatives that you could use. Apart from the FMEA that we said, and then the RCA. There are other ones that you could use. And this is total quality improvement, which measures the current output and modifies it to increase efficiency. Okay, like how we're doing our program right now. If we are using the total quality improvement, what we will do is we will measure our online work that we're doing now, how you take the test, how you get your results, the reception, the internet service, how it comes, how clear the tapes are or the recordings are. And then we will look at it and say, okay, we can modify this structure that we have right now to increase our efficiency. We can get more clear, audible tapes and voices and clear pictures, images, and to make sure that you get the information that we want you to get the way we want you to get it, and also to ensure that our quality of service is more than you even expect. Okay? That's if we are using the total quality improvement. We measure what we're having right now, our output, and then we modify it towards efficiency and effectiveness. Okay, so the improvement can occur at individual levels or team levels or organizational levels, which means you can also use it. Look at your way of going to work right now. Look at it, modify it. Okay, I go by train. So maybe I should buy a scooter and go to work because the train is not that reliable. You modify your way of going to work. You use the total quality improvement. You improve the quality of going to work. Are we all good with that? Are we all good with that? All right. So, and then there's another one called continuous quality improvement. That one is statistical methods that they use the data that we give them. They use that to improve the work processes. So if the data indicates that we did 1,000 trays last year and this year we did 800 trays, out of the 800, maybe 100 wasn't good. Last year, the 1,000 that we did, only 50 were bad. It means we are retrogressing, we're going bad now. So based on these statistics, they will use it to involve our input and various personnel and then identify what training we should get to change the process so that we can go back to doing the 1,000 with even fewer deficiencies. So the continuous quality improvement takes care of that. And then the first one that we talk, it just looks at the current situation and modify it for efficiency. The continuous one it's more scientific, use more statistics to work, look at the charts and tables, and then try to train our workers and to change the process. It focuses on expected quality outcomes. So if the quality that we had as per the statistics was maybe 90%, they should be able to use it and give us more training and process changes to attain maybe a 99%. Then the next one is the total quality management. See that we have the one that said the total quality improvement. That is the first one. Don't confuse it with this. This one says total quality management. The improvement is different from the management. The improvement, our goal is just to go up. This one is management, which is more about sustainability. All right? More about sustainability. So organization-wide, the approach based on participation of all members, it aims for a long-term success. So what the key word I want you to actually attach to this total quality management is sustainability. Sustainability. We should be able to sustain whatever quality that we have. All right? We're managing it to sustain it so that it should be consistent. All right? So it aims for long-term success through customer satisfaction and ensures tasks are performed correctly the first time, eliminating the defects and waste. All right? Others combine programs. So it's up to the management and the facility. All right. So the total quality improvement is what they're breaking down here, which I think what I've given you is enough. You don't need too much of that. It involves measuring current output. We said that. An improvement can occur at individual level. Fine. We said that too. So the continuous quality improvement statistical method, I told you about it already, it involves input from various stakeholders, which is our #1 goal, get everybody involved, all right? And then multiple users can help identify areas. Since we have a multidisciplinary group, everybody's gonna come in with his area and the problems that he has from there. And together we come up with one formidable plan to go forward, to improve our quality. Then the total quality management has come, which I've told you to use maybe to remember this, take it to be sustainability, okay? Sustaining your quality for the long term. It has to be sustained. We should do it right and do it for a long time, consistently, all right? And the aim is long-term success and customer satisfaction and benefit to all members of the society, not just our facility. The requirements of it is that you have to maintain quality standards in all business aspects, and that is the key to sustainability. Ensure tasks are performed correctly the first time, and then it keeps going that way so that you can eliminate operational defects and waste. Any questions? Then comes this management method too, which is the 6 Sigma and then the Lean. The Lean is a different one, and the 6 Sigma is a different one. The 6 Sigma actually aims for high performance and reliability. High performance and reliability. All right? It focuses on near perfect products and services, eliminates variations to prevent defects, so no substitutes, and uses DMADV for new. We know that the Sigmas they could use for new. If you're using it for new processes, it has a whole different impact. And if you're using it for existing processes, it has a whole different impact from there too. I think I took note of that. But there's one that the book hasn't mentioned yet, which was the I think I'll get that for you. Use in the I'll get that one, the Sentinel event. That you also need to know about it, because there are at times you get a question on the Sentinel event, which is more of an unexpected occurrence involving death or serious medical risk. That is one of the issues that came out with the Sentinel effect. It has appeared several times on the test. But if you see it, you should be able to understand it. It's an unexpected occurrence in the facility involving a death or serious medical risk. All right, it comes within this quality management area. Okay, so that is for the Sigma. It's actually focusing on near perfect products. Near perfect. We want high quality, but they emphasize near perfect. It must be next to perfect. That is the whole thing that you should remember about the 6 Sigma. Near perfect products or services, because it's aiming for reliability and high performance. So it wants things next to perfect, all right? And then the lean method preserves value with less work. They preserve value with less work. It's like they try to reduce, they focus on eliminating waste. That is the key. The lean method of quality management focuses on eliminating wasteful processes. It reduces production time and cost and provides immediate and long-term benefits, okay, with common goals to the facility. Any question? Does anyone have any questions here? Any questions? All right. So the Six Sigma is what they've broken down here, which you don't need that much. And the Lean 2 is what they've broken down here. The key tenet of Lean is preserving value and less work, eliminating wasteful processes. Those are the major things that you need there. Because even if the questions you drop, it's going to ask you about eliminating wasteful processes, which also involves, it brings about increased productivity and error reduction. Okay, that brings about improved customer lead times. And then the long-term benefit is that enhanced financial performance. Definitely, if you are eliminating waste, you're surely enhancing financial performance and higher customer satisfaction, improve staff morale because you feel good when your work is done the right way. Any questions? Any questions? Okay, we're doing good so far. I think our pace is good. Most of the slides will be repetitive because we want you to actually get into details with that and get that like locked up in you, that it comes as second nature. All right. So quality at work, active participation in quality process. If you are active in this quality processes, you participate in there, it's going to ensure solutions and work out that will be like workable for everyone involved. Like as I told the scenario I gave you at first, it was a solution that was workable for me, my department, and also the OR. And that we all participate. It needs your active participation. Okay? Group work is always good. The cross-functional departments, don't say that they are perioperative. Maybe they didn't invite me to their party, but that doesn't matter. When it comes to work, be with all the cross-functional agencies around you, all the departments around you, all the stakeholders, all right? The common methods here is to identify issues. So you see this figure, I don't think it will be of much help to you, but you see that the numbers and stuff in there. With the book, those that have the book, you could see most of this on page 301. From page 300, you could see a lot of the information there that you may need, that will interest you for all these things that I'm telling you. So those that have the new edition, on that page, you see a lot of good information pertaining to this quality work, and then the group things that you have to work with. All right. So the common methods are there. Representatives from ORCS, I mentioned that already to you. Problem analysis charts foster better communication. So you're going to see all those charts. Some are in chart form, some are in tabular forms, everything with a lot of images indicating how work is done and the quality that we are making and where we are doing it wrong. So they have other quality programs and standards. There are agencies that also focus on this quality stuff. And some of the agencies are the Joint Commission. They talk about accreditation organization, ensuring quality standards. They come to you, surprise visits, they check everything that you are doing. Joint Commission. You may not be there yet, but you have heard of it, I think so. Right now, with all these professors coming in, somebody has made mention of the Joint Commission, the TJC, all right? They conduct routine and unannounced inspections, and they require reporting and investigation of sentinel events. That is the reason why I made mention of the sentinel event that I told you just a minute ago. There can be an unexpected event that can lead to death or high-risk injuries. Okay? So you see that it just popped up now. The Centers for Medicare and Medicaid is also involved in this kind of programs. It's a government agency focusing on healthcare quality and patient safety. They can pop up anytime, perform announced and unannounced surveys. So you don't be surprised when you see them coming to your center. National Committee for Quality Assurance, they're also there. Hospital Consumer Assessment and Healthcare Providers, they also come in. That's the HACCPs, all right? Value-based purchasing, VBP initiatives, and then magnet status. Magnet status also evaluates the facilities and give them good or pass or gold. They give them medals, something. I think they give them gold status or silver or something like that. They have their own ranking for these facilities based on quality programs. So this is a joint commission that, as I said, and that's what they do. And then the Centers for Medicare that I mentioned to you, they also have their survey process. Then the National Committee for Quality Assurance, they also come, they are a non-profit, all right? The promotion of ongoing improvement is what they do. So it's like they come and canvas for improvement. They come and canvas for improvement. All right. Then we have the Hospital Consumer Assessment. They are also interested in this quality. So they come with a survey, standardized tool to measure patients' perception of hospital experience, pronounced as HCAHPS. All right. You see all that acronym they have there, they pronounce it as HCAHPS. They allow meaningful comparisons of hospitals from patients' perspective, and they create new incentives for hospitals to improve quality. See, by creating incentives, they push you to actually like improve your quality of care through public reporting, because you don't want the public to have a bad image of your facility. And so by so doing, they enhance accountability in healthcare through public reporting. Then we have the value-based purchasing initiatives, which compares hospitals and this the HCAHPS ratings from baseline to later performance periods. And then they penalize healthcare facilities that do not reach the HCAHPS goals. So you see how there are always checks there, all right, to make sure the quality is good. The magnet status is here too. It's an award given by the American Nurses Credentialing Center. They recognize hospitals for quality patient care, acknowledges nursing excellence, and highlights innovations in professional nursing practice. So you see, it's not just us. As I told you, it's not just about us or about you. It's about everything and everybody. Quality is more than quality. Just being good is not good enough. It has to go beyond good and has to be consistent, has to be repeated over and over. So look at all these people that are watching, all these agencies that are watching. Okay, any questions asked at this point? No questions? So I think you guys are getting it straight, because we started it right, telling you to put yourself in that position where you are looking at these things through your own eyes from a discomfortable position, so you understand it better now. As we go, you'll be fine. ISO 9001 standard, that is the international standard for quality. That's the abbreviation. ISO is International Standards Organization, as you see there. That's also another group that is watching for quality and awarding medals for quality. They're looking at you. They have their eyes open. Okay? International Standard for Quality Management Systems. They're used by companies globally. So you see that we've left New York and now we are global now. We're not even just international. We are global. Okay? There are eyes globally watching us. They guarantee quality, ensures consistent delivery of quality services, and ensures consistent delivery of quality products. So quality central services procedures. You know we have our departments. And those with a book, I think you need to do thorough reading from pages 301 to 307 should give you one-on-one and up-to-date quality services and procedures in all our departmental units. From the deacon, how we have to keep that place, to the parking area. Well, I'm going to mention a couple of those things as we go. The slides will give us some of them, but I expect that you guys will read thoroughly, because that is what you're going to do. I'm telling you, I'm selling you out as professionals. Anywhere that I stand to talk about this group, I talk of you as professionals. And this is why I want you to read thoroughly, empty that page 300 to 307 of the new edition, because I don't want you to mess it up when you're asking even a question about it, or you go to a place and then you are not even acting right there. No, it will mean that I have not spoken the right words about you. but I'm pushing you out anywhere that I go as professionals, not just as technicians. All right? So don't let me down. All righty? Take note of that. Those pages. It's only about 7 pages, but it tells you everything about quality service procedures in the CSPD in our department specifically. All right? Okay. So every technician should actively participate in the quality program. That should be underlined. If you have a pen, write it down somewhere. Help or report others struggling with processes. That's what I told you. You are not reporting them. You are not snitching on them, as we say on the street. You are not snitching on them. The point is, you have to help them, talk to them, and or tell your supervisor, this guy is struggling with doing this tray, or struggling with the decontamination process, or struggling with loading the washer, because we go as a team. And the aseptic technique number 5, as I keep telling you, tells you, don't just ignore it. As soon as you see it, act, jump in there, act right away to stop it. Because remember, one of your key jobs here is to prevent the chain of infection, to cut it, to break it. So when you see that something has gone wrong aseptically, please take on the number 5. Quick, get in. Talk to the person, correct it, and talk to him. If he's struggling and you don't think you can help enough, let your supervisor know. It's not about firing that person. It's just about making sure that he gets the training that he needs. He gets the support that he needs, okay? And there should be departmental audits. Regular audits keep functions optimal, so that if it's not happening, then you could ask your supervisor, why don't we have, do we have audits here, departmental audits? If he says no, or maybe sometimes you say, hey, please, can we have it so we can know what we are doing? Nobody will be offended by that. But it's good for you too, because as I keep saying, it's about your safety, it's about my safety, it's about the patient care. And that is, patient can be anybody at any time. All right? So let's make sure the career that we've taken, we can also make it straight as we want and perfect as we want, so we can enjoy it as a career. All righty? So there should be regular audits to keep functions optimal. Okay, regular audits can be performed by outside departments or CS staff, or within ourselves we can do it. Following policies and procedures, that's what they're going to be looking at. Are we following it? Do we have the right detergents there? Do we have the right sink that we're using? Are we measuring the detergents right? Do we have an active role in quality improvement? Are we keeping abreast with technology? Are we ready for surveys? If anybody should pop in at the SPD, are we going to get a good remark, a good record? Are we going to get like 90% that we're doing the right thing? Are we placing our things in the right places? We said that the ceiling, from the ceiling to the highest point of the shelf, should be how many inches? 18 inches. Do we have it? The minimum should be 18 inches. Are we sure that we don't have things on top of that shelf? We should be survey ready. And that is all about the SPD and quality service procedures. We should have a team mentality. All right? And then we should have our CS certification, which I know you'll get it in a few days or hours from now. Okay? So the departmental audits, regular audits, as I said, types of audits, they performed by outsiders, or we do our own by the CS, or can they let the nursing department come and do it? Any stakeholders around, we could use them based on what we're trying to get. If you want to get genuine feedback, that's a lot of times you should talk to the text from the OR, the scrub text that interact with the SPD. They can tell you everything about every worker in there. If you want a genuine response, you should do that. And it's good. All right. The role of the technicians, they should be valuable assets in audits. They should be able to give us what is on the ground. They have in-depth knowledge of environment and processes. That's what I'm saying, that if we use even the technicians around the scrub text, they can give you the valuable information that you need for a departmental audit, so you can improve your quality. Any questions? So quality is also about following policies and procedures. We have to ensure safety, all right? We have to maintain high quality products. That is one important thing. Protocols, I tell you that it's about the culture at the place. The protocols that we have, ensure products are of the highest quality. So if you go there and the culture there, the protocols there, it's not providing high quality. Don't compromise your training that you've had and the quality that you have in yourself. Talk about it. See if there could be a change to make sure we're getting the highest quality there. Well, you can bring a change there too. All right. But I know that wherever you go in an SPD that is functioning, there's always protocols that ensure products are the highest quality. And those are the protocols you should also follow. All right. But if it's not giving you the high quality, things still coming out dirty, you should talk. Quality control is dependent on these procedures that we're talking about. And the consequences of non-compliance is big, it's massive. Non-compliance can cause the whole facility and can cost you your certification too. Not following policies can lead to safety risk, and non-compliance affects product quality. And the non-compliance, if it goes to the worst, a whole hospital could go bankrupt. All right? Any questions? No questions? All right. So keeping current with technology. I think that is what we should do. You see the image there. What does it tell you? There's a computer, there's a laptop, there's a phone. Can anybody tell us anything practical about these three things there? What does it tell us about technology? Anyone? What does this image tell us about technology? We had the phone. Now we have the tablet. Now we have laptops. Yes, Shania, yeah, what is it?
Sharing knowledge with coworkers and supervisors.
Okay, you see, with these three technologies there, you could share knowledge. Okay, anything else? Anything else? What does it tell us about technology? You could communicate.
Communication.
Yeah, Tafik?
Communication.
Communication, yeah. That's the same thing that Shania was saying. Communication is the key here. We have to communicate. And then secondly, looking at even those three instruments there, these three gadgets that you see, we have a phone, we have a tablet, we have a computer. They all help you in communicating. It has also been that there were phones even before tablets came into being, which means that we've moved forward in technology. There were phones. And then now this came tablets. And now we have the laptops and everything. So after all this, these laptops keeps going up in technology. Now they have you can do snapshots on your thing, your phone. You can just do anything that you want to do. You can even start your car from your phone now. All right. Very soon we're going to be starting our autoclaves on our phones. Okay, so you see that it's high tech, but we have to stay abreast with technology and use it to the best of our advantage. Communicating with our co-workers, it's good. We have the phone there. We have WhatsApp. We have messaging. We have emails. You can just communicate right away. Send something. You see, they mention an instrument. You don't know it. Google it right there. You get the image of it. You know, oh, this instrument. I've seen it. I just don't remember the name. It's this instrument. Oh, that's a mosquito. Oh, I've seen it. That's a mosquito faucet. Yes. Okay. We have to take advantage of this current technology and stay abreast with it. All right. You have to share new knowledge with co-workers and supervisors. Enhance work efficiency through technology. As I said, they mentioned the instrument. You don't know it. It may have a different catalog number and a different catalog name, but just by Googling it and the image coming, you know what it is. Okay? And then advancement in product development, new products. You remember these computers are designing these new products too. So new products for checking residual blood and protein are coming out. Very soon, people will be using just their phone just to scan their forehead and they see whatever is wrong with them. Okay? Look at when COVID started. Look at the new scanners they brought out, the new thermometers that came out. Just point it to your forehead and your temperature is right there. If it's more than 100, they say, go home. You can't come out. You are prone to COVID. All right? So you see these new things are all coming out. High-tech technology is growing fast. Complex instrumentations are coming out. So we have to stay abreast. We have to keep current with technology. All righty? Active role in quality improvement. We have to be very active in quality improvement. We are not just going to be bystanders. We don't have to stand and say, oh, this thing, I knew it, but that time I was not born before computers, so let it go. No, it's a no. You were not born before computers, but now you know how to use a phone. So know that when you were not born before, you were born before phones, but now you are using phones. So if you were born before computers, you should be able to use computers now. All right? So always be active, play an active role in quality improvement, active participation. You professionals going there, you should engage in all process improvement projects. Don't keep yourself out of it. Technicians have extensive knowledge of department activities, but you have to learn to have that extensive knowledge. They can identify problems effectively, sure, but then you must know to be able to identify, and they can contribute to finding the best solutions. That is if we want to do it. So you should do it. Don't say that, oh, I don't know. We go to a tech. Oh, do you know about this instrument? No, I don't know about it. Ask the other guy. Please don't do that. Avoid that. Contribute to finding the best solutions. Okay? Survey readiness. As I said, things should be placed where they should be. You know the rules. This thing should be up to this point. No dirty instruments around the packaging area. Decontamination area takes all the dirty instruments. Fine. There's no reason why a clean or sterile instrument should go to the decon. It must not happen. So remember, if an unannounced inspection is happening, a survey is happening, the Joint Commission comes in, they see a clean, sterile instrument wrapped completely from the OR next to a sink. It came back, but it's placed next to a sink, completely wrapped. It's sterile. It just came back because somebody took it out. They didn't take it to the OR, brought it back and put it next to a sink. What do you think they'll do? Is it acceptable to put a sterile instrument, a wrapped instrument, next to a water point, next to a sink? Is it acceptable? Is that survey readiness? No.
No.
Because it's at the wrong place. So
Yeah.
you must be survey ready. Place things where they belong. Whatever is prohibited there must not happen there. Don't go there with no PPEs. No. You must have your gloves, must have your PPE intact. When they come, and then they come to the decon, and you are in the decon with just a PPE, no mask, no hair protector, no goggles or nothing. You think it's going to be right? You are not ready for the survey. You must show survey readiness. You must be dressed intact. Your PPEs must be on. That shows that you are survey ready. But that is for your own safety. There's this thing that has been bothering my mind for a long time. One time, Professor John spoke about how people sneak to even eat at the decon or drink water at the decon. You know what you're exposing yourself to? This is the reality of it. There is a reason why the decon has negative air pressure and the air exchanges. All right? The air is contaminated. There are aerosols in there. Aerosols, no matter the preventive measures that we take there are aerosols there. That's the reason why you have the mask and the eye protectors. There are aerosols there. So if you want to just deceive yourself that the water bottle is clean, so I took it to the decon and I drank water from it, what have you done to yourself? Somebody should tell me. What do you think you've done to yourself? Someone should tell me that. What have you done to yourself? You didn't do it to a customer, but you've done it to yourself. Tell me.
Exposing yourself.
You have exposed yourself to the numerous microorganisms in there. Remember, the key here is that you don't see them. They are microorganisms. Micro. So because you didn't see them and you have a clean water bottle sitting there, you take your mask off, you open the bottle, the water is exposed, your mouth is all exposed, now you're drinking the water in there. Tell me, breathing the air in there, what do you think you have done to yourself? You didn't cheat on anybody. You cheated on your health. Are we all on that page? So people doing it doesn't mean you should do it. Your safety is in your hands. So even if you see somebody doing it, don't do it. See somebody going to the SPD with water, don't do it. Even though we've told you all the risk that it comes with, people will do it. You should not do it. Because you are not doing it just to the patient that may be in that way, but you're doing it to yourself. It's not a good thing. It's not a good habit. Disease from it. Nobody will stop you from taking your clothes, changing and going outside to go drink water. Nobody will stop you. So why would you do that? Why will you be so lazy to say that, oh, I can't take this off, so let me just sneak and drink the water here? It's not safe, please. For your sake and for your family's sake, don't do it. All right? Good. So be survey ready. And I don't think you expect them to come and see you drinking water in there or having what you're not supposed to have, your golden watch and all bracelets. No. Please don't do it. Team mentality. Be ready to work in a team. Be ready to work in a team. That's all I can tell you about the team mentality. Be ready to work in a team. Don't isolate yourself. Seek help where skills are not as strong. If you know that you are not strong in the computers, seek help. Let somebody help you. You click a thing, it's not coming right. Call this guy. Hey, Charlie, I want to print this document, but it's not printing. What is happening with this? You come and maybe the thing is right there. At my job, they said something that was so funny sometimes. I went to another floor from my floor. They had a problem with their computer. I didn't know about it. But when I saw that the computer had a problem. So I sat by the computer, I tried it, and I was able to get it out of the situation. But then I had to put a password on it because there was a password that had locked it up, and I was able to open it and then put a new password. So I put it on, and then I left. The next one of the workers said, I know you came to this floor. I said, what happened there? So our computer was locked up and you opened it, but it's still asking for a new password. But then I texted it to them in the night. So I said, check your phone. I put a new password there. He checked his phone, he put it in, and it opened. So now, the next time they had a problem with their computer, one of my managers said, hey, don't call that guy. If you call him, you put a password on your computer. Okay, you say, look at that. You see it was just like a joking situation. But the point was that we are not scared to call anybody to help. Oh, this thing is not happening here. So another lady said, oh, just call Charlie. If you call Charlie, just by mentioning his name, the computer will start working. You see? So we do it. We call each other to do it. It's something that we do. So don't be scared to do that. It doesn't matter if somebody knows computer more than you. We went to different schools. We were born at different ages. We don't have to know everything. You always have things that you are good in. And that's how the world is. That's why we need each other. Right? So help those who need assistance. When you need assistance, call for it. Prepare your mind to work in a team. Prepare yourself to work in a team. All righty? I think that that's not a difficult thing to say. It's easy to ask anybody for help. And you should get it. CS certification, certified technician. Before you work, you must be certified. So those that are ready to even go for the clinicals, it's going to give you an upper hand even in doing the test. Okay? So understand the reasons behind your procedures, ensure practices are followed correctly, and then quality assurance should always be something that you're thinking about. Knowledge of science behind practices. Why do we say don't drink water at the decon? Why do we say don't take food into the decon? Why do we have the negative air exchanges, the negative air pressure in the decon? Why do we have the air exchanges in the decon? To get this bad air out. All right? Understand that science. When you understand it, you are going to be good for quality assurance and providing the quality care and the patient care that we want. We want to get it. All right. So long as you understand these reasons behind these procedures and practices, you should be good for your certification. Any questions at this point? I think we've made good time. We should be ending it soon. So quality in central service. This is the decontamination area. Look at what it's telling you. And that's what I've told you to read the book from page 300. Please read it religiously. You will know everything that will make you survey ready on the job. All right, especially those going for the clinicals. Don't go and do things that they are not expected to be done there. It's all in the book from page 300. Please read it. Please pay attention to it. Decontamination area, wear personal protective equipment, PPE, to protect yourself. Disassemble items to ensure all parts are accessible for cleaning. These are things that we've told you over and over, so I'm not going to waste too much time on. Measure chemical properly for effective cleaning. If this is the cup measured device that we use that. Don't just assume and pour the detergent by just, okay, I want to pour like 2 minutes, I'm going to get this quantity. No, it's a no-no. Load and operate equipment properly to ensure effective cleaning. Don't overload the washer decontaminator. Don't overload the autoclave. I keep telling you that. Professor John tells you, Dr. Mike tells you. Check processing equipment before use. The IFU is there. Check it. Check for holes in wrappers and possible filters before sterilization. Don't just take the wrap and think it's good. When you spread it, look at it. Make sure it's in good condition. No perforations in there before you use it to wrap the instrument. Storage and distribution areas must be clean. Okay, all central service distribution areas must be very clean. The contamination area, the decon, as we always talk about. That's where they bring all the instruments to start the reprocessing. Okay, from the OR, after they do their pre-cleaning, it's gonna come there and you start your job from there. Right? Personal PPE, good. It has to be there. The PPE is always there. We're talking about it. Always wear it. Disassemble parts, like the instruments with this box locks will come. You just have to open them up, all right, so that they can clean properly. All right, measure chemicals accurately. Load and operate, no overloading. Good. This is enough for you. Preparation and packaging areas. Check wrappers and filters that they are not faulty. The wraps are not perforated and is the right size, because you need to wrap it a bit loose, not too tight. All right. Ensure no holes. Normal handling can cause damage, so be careful. Handling dropped in items, they need to wash before you. If it's dropped, do not use items that have fallen on the floor. Reclean the instruments and discard wrappers and filters that are falling on the floor. Put them in the garbage right away. The instruments, just go and rinse them from with clean water again, and then come and put them back in here. Don't just take them from the floor and go put them in the instruments. You're going to contaminate the others in there already. Okay, so reclean instruments and discard wrappers and filters that are on the floor. Use FDA approved wrappers and containers, which is not your job. They should be there when you go. All right. If you doubt it, question your supervisor. Ensure they are approved by the specific sterilization method. Follow count sheets. Almost every instrument in most facilities have count sheets. The count sheets are the number of instruments that are supposed to be there, their name, their description, their catalog numbers. If you want to track it, if it's missing, you could use the catalog number to find it and find a replacement. Some of them have images that will tell you this is the instrument. You can look for it and replace it. All right. So follow count sheets, then just use your brain and say this is 20 instruments in there, so we put 20 instruments. It must be 20 specific instruments. So use the count sheets. Correct supplies are crucial for patient care. Check instruments before you put them for sterilization. At the sterilization area, loading the carts, I keep telling you, always load sterilizer carts as trained. No pulling, no dragging, lift the instrument, especially the wrapped instruments. The wrapped instruments, be very careful with them so they don't get tear, torn, or perforated before they come out. Setting sterilizer parameters. I've told you that is not your job, but then as you go on, if the instrument tells you that you scan the instrument and it tells you this is the parameter, make sure. I did one a couple of days ago. I set an instrument that was for 270 4 by 40 for 40 minutes dry time, and then I pressed it to as soon as I put it in, I pressed the button, and I realized the button that I pressed was the 270 by 4 by 30. So I just pressed the abort key. There's an abort key right there, which terminates the process. So I just pressed the abort key. It terminated the process, and I restarted it, pressed my actual parameter that I needed. The 270 by 4 minutes by 40 minutes dry. And I pressed that one, and I did it. Okay? I didn't have to wait till it finished the cycle and then recook it. That's waste of resources. There's a button that's there to just abort that one, and then I just aborted it and restarted it. Aborted it, I get a printout, and then I restarted it with the appropriate parameters. Okay? It's not a crime to do that. Alrighty? And verify your indicators. The tape, the external indicator, is it good? Is it expired? Or is it good enough? Are the colors correct? And when it comes out, look at them too. Don't put a tape that is almost faded on there. Make sure you put that you don't put a low steam indicator on a high steam instrument. Okay? So handling, ensure the process was properly completed too. When it comes out, when you go to the sterilizer, make sure it says complete. Cycle completed before you press to open it or take your printout. If it says circle aborted, you have to look at it and question yourself and look at the printout before you take any action. All right? Do not touch sterilized items until they are cool, until they are about room temperature. Look on the screen. The data there is going to tell you maybe this thing is 204 degrees or 189 degrees. Still, it's not even safe to touch it, even though you have your gloves on. Still not safe to touch it. 187, it could burn you right away. Let it cool down. Okay? Good. So when it's done, do not touch it. Fine. When it cools down, you take it out, you go and complete your documentation. Any questions so far?
No.
No questions? So you see that this has been something that has been very practical. I told you earlier, it's practical, and where I made it to put yourself into, it's like you've seen everything real, and then you know your commitment to this job and what you're supposed to do. Storage and distribution areas. For quality purposes, follow the established pick sheets. They brought you that we say we need 2 sinuses, 2 Nagaharas, 2 striker drills, 1 micro drill. Give them just exact. Don't ask them, why do you need 2 sinus trays? He says he needs 2. That's the sheet he brought to you. If you don't have the 2, it's a different thing. Give him what you have. But if you have the 2, don't tell him that you're taking too many instruments. Get only 1. No. Follow established pick sheets. Ensure all items are picked and delivered accurately. Maintain cleanliness of transport and case cards. They need to be wiped down every day. Don't just go and say, oh, we always use it. So you go to any mood that it is in, you just put the instruments on. No. Make sure they are clean. The cards also need to be cleaned. Okay? Ensure cards are clean and dry before use. See what I told you is what the slide has also mentioned right now. Check product packaging. Don't just pack it because it's clean there and then it's sterile. No. Look at it. Turn it around. Is it well taped around? Are the indicators good? The external indicators, did they change color the way they should? Check the product packaging. Verify integrity, expiration dates, and indicator color changes. Look at those things before you go and put them in storage. Any questions? Any questions? No questions? Okay. So all central service distribution areas should have this. You have to always focus on the job. Avoid excessive visiting or distractions like loud radios. All right? You cannot be blowing some music in there like you are in a party house. No. Even some areas will not even let you go with your phone. If they allow you, please don't go and play music in there. Nobody's saying that music is not good for you, but if your facility doesn't allow that. My facility sometimes even in the OR, there were some cases that they were even playing music during the surgery. I don't know what they were doing there, but there was music in there. So when they finished and they took the patient, I said, what was happening here? Was it a party? And they said, no, we just put on that music because I think the doctor wanted to whatever that was. It was strange to me, but it happened. And it was a perfect situation. What do I have to say? Nothing. They wanted quality and they were able to deliver it that time. I don't know who called for that, but it did happen. I don't actually know which doctor did that. But it was a group of doctors. It wasn't even one doctor. It was about 4 different doctors. And the case was a very, very long case too. All right. So maybe they were doing it during the preparations phase of whatever they were doing it. That was it. But then if you go follow the policies at your place, when you go to Rome, do what Romans do. Don't go and then decide to change everything there. Okay? Inform someone if asked to perform an untrained task. And I remember telling you, a doctor came to me with an instrument and said, and that was when I was even new. He said, I need these 2 instruments to take with me. And I said, sir, I need to follow the procedure here. It needs this time to go through the washer and through here before it gets safe for you to handle. He looked at me and nodded. He said, okay, so what time should I come? So I told him, okay, this machine is 46 minutes. It's going to take me a few minutes to wash it, put it in this machine. 46 minutes, it comes out, has to go to the clean side, and you pick it from there. So give me an hour. Oh, he said, okay, thank you. I'm going to wait. I'll get it. And that was a doctor standing in front of me, a new technician. So he had to go and wait and come for it in an hour. He thanked me so much. He said, thank you. Thank you. I didn't mean to actually rush you, though, when he came back to pick it up. That's what he said. I said, no, sir, I just wanted to do just the right thing for you. And I was new that time. Okay? So don't hesitate to do that. Project assurance, the project assurance, okay? Training and competence has been mentioned. You should be confident when you go there with all these professors talking to you. Trust me, show your confidence when you go out there, because there's nothing that we haven't told you yet. All you need to know that now is the instruments in the real situation. We've told you everything as at now, and you're going to get more until we are done. All right? Distraction management. Check the entire project if distracted to ensure correctness. Because if you're on the phone assembling an instrument, you may have left something out. Get off the phone and recheck it before you wrap it. Performance standards must be followed. Neatness and teamwork must be ensured. Alrighty? That's the end of the slide. Are we all okay now? Any questions? Hello? Any questions? Anybody has any questions to ask? Any questions, guys? Tell me. Are we all there?
Yeah.
Are we good with this quality
Yeah.
situation that we have to be in?
Yes.
Quality assurance is the key. Please go and read those pages that I've told you. The 300 to 308. It's going to give you everything to make you survey ready. Remember, they make unannounced surveys. Those that are going for the clinicals. You could be there, or you could even go and meet them there. So be survey ready. Read those pages for me. 300 to 308, please, in the new edition. Read that for me. If there are no other questions and we are all satisfied, I think we can take a break now and end our session. And then those that have access to the test, please do your tests. And those that are preparing for the clinicals, be in your preparation mode, ready to go and excel there for us, okay?
Okay, thank you.
All righty. So have a great week. We're meeting tomorrow, right?
Yeah.
At the same time. So without any questions, we're gonna end our class today so that we can converge tomorrow and take care of our business too. All righty?
Okay.
Okay, thank you.
You have a good night.
Good night, everyone.